What's up, and welcome to another episode of Black in the Maritimes. I'm Fidel,
I'm Hillary.
I'm Clinton.
and this is a very maritime episode because everything topics that we got is all maritime related. We're gonna start with COVID-19 in New Brunswick. COVID-19 in New Brunswick, and I will say, I will put a picture from 2020 when COVID started to 2021. It took us around 11 months, almost a year, to get to 5,000 cases. New Brunswick was doing that good. It took us almost 12 months to get to 5,000 cases. Uh, from 2021 to 2022, will be from from October to December. We reached 5,000 cases in 3 months. So this is how bad New Brunswick is doing that. What took them almost a year, they did it in 3 months. So the government has decided the following. The government has decided to not give you PCR tests, which you could have gotten for free anytime if you felt you had symptoms. It's only giving it to people that have severe illnesses or severe type of conditions. You will only get a PCR test. They stopped doing contact tracing, so they're saying that you have to do your own contact tracing by doing rapid tests. And guess what? If you want a rapid test, which they were giving away for free, they are not giving it away. You have to register. And then when you register, and if you are ill and you have conditions, then you will get a rapid test. So they cut PCR testing, they cut rapid testing. They're not doing contact tracing anymore, and they not count it. This is because it has gone way out of their hands, and pretty much they kind of gave up a little bit. So, Hillary, what's your take on it?
Unfortunately, that's the same situation we're facing here in Ontario. So my family unfortunately caught it a second time and they were denied PCR testing, and we don't know where to go get rapid tests because Dougie Ford is giving them out at Yonge and Eglinton Station and the LCBOs, and that's basically it. And my family, being Muslim, is extremely uncomfortable going into a liquor store to get something integral to their health. So it's just as bad here. I don't I I guess I can understand a little bit Ontario like sort of running out of options and solutions, because we were at like 10 to 15,000 cases a day. For New Brunswick to have already run out of resources and capacity says so much about the healthcare system in New Brunswick and what is wrong and where funding is needed. I think it's really sad. I want to say that I think it's sad that Blaine Hakes caught COVID, but we all know how Hillary really feels about that happening. Had you maybe put proper restrictions at the beginning of this almost 2 years ago, maybe Blaine wouldn't have caught COVID as well. I think it's really unfortunate. I don't know how this is ever going to end anymore. I will repeat what I said in our, I believe, year-end recap episode, that it's about educating the people who are unsure about being vaccinated. But like Clinton said, this is not going to go away. It is like the flu. So we have to figure out how to adapt. And adapting is not taking away the PCR tests and the rapid tests and closing everything again, because it's clearly not working. That's my 2 cents.
Clinton, what's your take on it? Especially that you've been affected by COVID because of your business. Like this has affected you directly in times that you never thought it was going to affect your business.
Absolutely. Yeah, I'll comment on that first. It's definitely affecting my business. It's affecting my family. We're having a lot of close calls and a lot of close contacts. I haven't caught COVID yet, but yeah, even if a member of my team, someone in their family contracts COVID, they have to self-isolate for a week, which means I'm down a team member for the whole week. Someone in my close family caught COVID. I didn't catch it in that regard. So it's been tough. It's really out of control this time. Fidel, like you said, you summarized it really well. I think the New Brunswick government has given up. Hillary, your point regarding increasing education is a really good one. I think more people should probably be vaccinated, but I don't think that will reduce the instances of people catching COVID. I think that'll reduce the severity of the people that catch COVID. My personal opinion, although I haven't heard it mentioned very much, I was talking to Hillary earlier this week. She said she saw it on Twitter, is not necessarily that they gave up, but I think they're silently really trying to attempt the herd immunity conversations that we heard people and governments talking about in early and mid 2020, the concept of herd immunity. Now, no one said that, but it really seems to be what the New Brunswick government is going for. They're not doing the PCR tests anymore. Registering your results online, when you go to the website, it is 100% voluntary. So even if you catch COVID, even if you get a positive test, there's no sort of implementation in place that says you have to tell anybody. It's completely secretive. The current stipulation is that if you catch COVID and have a positive test result, you only need to isolate for 5 days. Now, the truth is, it says you need to isolate for 5 days. And then for the next 5 days, they advise that you stay away from events and indoor gatherings and stuff like that before you really go about your life. But from everyone I've talked to, the general consensus seems to be, if I catch COVID, I only got to isolate for 5 days and then I'm gravy, I'm good. So you're going to have people throughout all of New Brunswick knowing they have positive COVID tests being out and about. So it's really like, because I guess this Omicron variant seems to be
Shout out to Omarion.
Poor dude.
Because it seems to be so mild, I really think they put their hands up and they're like, F it, let's just try to get everyone catching it right now and just really see what happens. Like, this is the real social experiment, I think, more than even previous years. It's just kind of like letting everyone go out there into the wild and like just see what the F happens, which may or may not be a good idea. A virus's main goal is to survive. And so we know that viruses that kill their hosts have a much worse chance of propagating and spreading out and continuing their life. So it could be that all future variants of COVID will be less severe, or it could be that there's going to be mutations that get way worse. And then eventually, years and years down the road, this does become like the common cold or the flu and stuff like that, where we try to get our vaccine boosters and such. But regarding New Brunswick, yeah, it's just no hold bars. It's a free for all. No one needs to register their results online, which means coming as of now, the numbers are going to be skewed. They're going to be all over the place. No one's going to actually know how many COVID cases are in New Brunswick. No one's going to be keeping track of it. And yeah, I think a lot of people are going to catch it. It's literally everywhere. A year ago, last thing I'll say, it's a year ago, you watch the news every 2 hours, you feel like it's everywhere, but it really wasn't. It really wasn't anywhere. Like 0% of the population had it. But now it is literally lurking around every corner, in my opinion. And yeah, we're trying to keep our seniors safe, but I think everyone's going to catch it.
I do think that
Hillary, did you want to say something? Sorry, I saw Hillary with her hand up.
No, you can go first if you want. I just had a comment about the multiple versions of it.
Well, I do agree with Clinton. I think everybody's gonna catch it. I do think that that's going to happen. Now regarding of New Brunswick in particularly, I will have a little bit of an analysis and a prediction to say to this. When we started the COVID-19, this is when around 2020. We locked in early. We had pretty good numbers, and we were pretty much lucky because we didn't have vaccines, and we were able to keep pretty good numbers. Now, the New Brunswick government got loaded up on liquor about this, and the conservative government took it as an opportunity to get a majority, which they did. Because they were boasting up on how well they did and their perception, and I think that's the thing. I think what the New Brunswick government is doing right now is a perception play, because people are not going to put their information, because they're not counting. The numbers are going to go down. That doesn't mean that they are going down. That means that because that's not happening, they will go down. So that will be the perception that people are doing better, and eventually people will start living on their lives, and people will stop just doing what they're doing until what the common thing, maybe herd immunity, maybe everybody's going to get them, that their immune system, or maybe people are just not going to go to the hospital. That might be. Now, here is the problem. The problem is that I think that the messages has been wrong all the time. I think the messages always been the reason why we don't want people to get COVID, we don't want people to get infected, is because of the hospitals. if the hospitals get overcrowded, the people that have other things such as heart attacks, kids being sick, won't be able to get attended because they're going to be full, and their health staff is going to be short, which is happening right now. There's a short staff of help because they're infected. If that happens, that could bring a collapse in the system. And if it brings a collapse in the system, other things will jeopardize, and that could do a chain reaction effect, right? So let's say that the labor, if the doctor is sick, the doctor dies, there's less doctors to attend. And if you look at Alberta, it's been happening that it's been happening in all the other people, their other industries have been affected by it. And I think that's where the message should have been since the beginning. If the hospitals are crowded, then we need to shut down. If the hospitals are not crowded, then we do not shut down. But I will predict that the cases are going to go down by perception. Uh, People are going to see that because it's going to be a perception thing, and people are just going to live their lives. And I think you're right. I think they're betting on a herd immunity because there's 85% of the people are vaccinated, which is more than enough to get a herd immunity, which is correct. If people get their booster shots, at least 50% of them or 60% of them, that will lead to a better herd immunity. And I think that might be a play that people won't go to the hospital, but we'll have to wait and see.
I was just going to add that in the news yesterday, Cyprus discovered a new variant that is an Omicron Delta hybrid. So it's already constantly shifting and mutating and changing. And I will also add that they stopped wait, what was it that you were saying? Not the PCR testing, but they're also not counting like all the numbers here either. So our numbers are going to be skewed here in Ontario as well, for people who actually contracted. So I feel like there's going to be a perception too, because they're not actually testing everybody anymore here either. And our hospitals are also like at capacity. The nurses are sick. And I know that my mom's nursing home in New Brunswick, several employees had it this time around. So it's sort of just bad all over, but it's really not looking great. But I think that this is going to be how we get herd immunity.
Now, the difference is between Ontario and New Brunswick, which I think Ontario is not to 80% vaccination. I think it's over 60% or something. We have good vaccination rates. We have like 86%, which is great. Which again, that's what you need for herd immunity to happen, right? If you have more than 75% of the population, I think it is, if you have them more vaccinated, I think that will help. So I think New Brunswick has a really good shot. Will it happen? Who knows? The hospital thing, I don't know what's going to happen if there's a variant, because again, but I think we have a better shot at that than Ontario just because of the vaccination rates.
I think I see 88.1% of doses delivered. I thought I saw 82% of all people in Ontario have at least one dose. 77 are fully vaccinated. But I don't even know if fully vaccinated now also means boosted or just two.
I think two, but yeah, just New Brunswick has like 85, 88 double back. So we have a good chance of getting this done, but we'll wait and see.
I don't know. The woman who gave me my booster, not to encourage concern in anybody, but she was she was a little old lady. She kept forgetting where she was setting things down before stabbing me, and I was like, this is not gonna go well. She didn't know where the alcohol sanitization went. She was like, when you have a lot of coffee and you just really need a nap after, she's like, I am so tired. And I was like, and you're about to stab me with a needle?
Maybe she didn't work in that room or that area very often. Maybe that she just was getting acquainted with her surroundings there.
It was here, it's like crazy. Like this was the top floor of a mall that was like industrialized, that looked like it was not a pop-up thing that was not part of like a hospital or a normal nurse's station. But she was like, I don't know where the alcohol swabs are. Which needle are you supposed to have? I was like, Pfizer, please. She was just like having a good day. Didn't hand me any paperwork, didn't tell me how long I had to wait for after the jab either. I was like, I'm gonna wait 15 minutes and see what happens.
Also, I will encourage people, get your booster shots. They are available to everybody in the public now. I'm getting mine, I think, the 13th. So everybody get their booster shots. COVID is not going anywhere. COVID doesn't give a fuck about what you think. So just get protected until we get like which there's a pill coming out in 2 months. I don't know when it happened, but once we have like Buckley's for COVID, I think we'll be fine. That's what's
You better
The
patent
pill,
that right
the
now.
the pill is going to have the chip. Okay, so the liquid, so the liquid vaccine didn't have the chip. We thought that was ridiculous, right? But I can't wait to hear the conspiracy theories coming out about the pill, because they can put the pill in the chip.
Which they're gonna put it by Facebook, which already is tracking you. Like, seriously, dude. Like you're gonna say your conspiracy theory in a place that is already tracking your information. Like, what the fuck,
on
dude?
Facebook, yeah, exactly.
Or Twitter or Instagram, that they already track where you are, what you do. Like literally, dude. That's already been gone. Like, if you were upset about like people tracking you, that chip has sailed a long time ago. So
I don't even know what the chip was supposed to be for. Did the conspiracy theorists mention that?
Therapists.
Was it for like a brain control chip, maybe, or like a?
I thought it was just to track your like
you.
existence.
Yeah, like to track, like,
to follow you.
That's a boring conspiracy theory.
And it's
sure.
like, dude, the social platform that you're putting this on is already doing that. Your cell phone, like, they're already doing that. I think I will say to people before we move on to topic, the government is not that smart. Private corporations are. That's what people need to understand. Whoever has the money has the IP. That's how the world works. So just to make you think, don't get me wrong, I think the government of Canada has very bright people. But unfortunately, Google has more money to pay those bright people. So they will go wherever it is. So